Hello all, this is Dr. Alsop, and in this video we will be discussing muscle attachment point terminology. And by the end of this video, you should be able to define specific muscle attachment point terminology, so the terms that you're going to hear us use, and then describe how these points will actually impact joint movement. Now, why would we have you know all these muscle attachment points? I promise it isn't just to make you memorize more things, but really an understanding of attachment points will guide you in understanding which joint or joints that muscle crosses. And when a muscle crosses a joint, it can affect the actions at that joint. And that's really what we care about there. Now, when a muscle contracts, specifically when it shortens, and really the real term for that is concentric contraction, one of these attachment points is going to be fixed or stable, not moving. The other attachment point is going to be more mobile, so it will pull the bone that the distal attachment is on towards the fixed attachment point. Now, fear not. In anatomy, we will only be highlighting the most clinically relevant attachment points. So you're not going to have to memorize every single attachment site of every single muscle. But understanding some of these attachment points, particularly the ones that come up more common clinically, that can really help you understand some fairly important clinical considerations. So an attachment point can increase in size with use of the muscle, or inversely, it can decrease in size with decreased use. And understanding these attachment points can help guide a physician, say in an orthopedic assessment, understanding specific surgical implications, developmental and age-related changes in both muscle and bony attachment, as well as these attachment points are particularly important in rehabilitation and strength training programs. So there's a rationale behind why we have you understand these. The traditional terminology for muscle attachment points includes the terms origin and insertion. Origin is typically associated with the attachment on the proximal or superior end of the muscle. In most concentric contractions, this is fixed. This is the non-moving part, but not all the time, and that is why there's been a movement away from these more traditional terms. Insertion is typically the distal or inferior end of the muscle. This is usually the kinetic or the moving attachment, and the bones will typically move toward the origin during concentric contraction. So in this example on the right, we're looking at a cartoonish, not very accurate version of the biceps brachii muscle, which is located in the anterior compartment of the arm. The origin is going to be more proximally located on the wrong bone, unfortunately, in this image, but it still gets at the concept. The insertion is going to be on the more distal portion, and this specifically is the radius. And with flexion of the elbow joint, that insertion will move towards the origin. Now, I mentioned that there are exceptions to the rule. Say during flexion of the shoulder joint, which biceps brachii plays a small role in, the origin or proximal attachment is the moving part. So that doesn't really fit with the more traditional terminology of origin and insertion anymore. Therefore, there's been a shift in terminology towards just more descriptive terms, such as proximal or distal attachment. Sometimes you'll hear superior and inferior attachments when you're not talking about muscles associated with the appendages. We in anatomy will strive to use these more traditional terms, these more descriptive terms like proximal and distal or superior and inferior attachments, but you'll absolutely see origin and insertion in textbooks. Now, before we finish this concept, I want to talk a little bit more about bone markings. Bony markings like a tubercle or a tuberosity will change size and shape throughout life based on activity level as well as mechanical stresses. Attachments cause many of these bony markings. And we've really focused more on muscle attachment so far. So the part of the muscle that actually attaches to the bone is called a tendon, which is not actually made up of muscle cells, but it's the connective tissue that's very intimately related to the muscle. But tendons aren't the only things that create bony markings. Ligaments, so ligamentous attachments, which is the connective tissue that connects bone to bone, as well as fascia, can create bony markings as well. All right, excellent. We have reached the summary slide. Please use this to assess your understanding of this concept before moving on. And as always, reach out if you have any questions. Thank you for your time.